are we supposed to do in this era of COVID-19? Now we're being told to wear two masks. Is that the right advice? Hey, I'm Dr. Charles, aka CoachMD. In my over 30 years of medical practice, I have made it my goal to help you create a great life by achieving a strong mind, a healthy body, and an unshakable spirit. Today I'd like to go over an opinion piece regarding the new charge of the CDC for us to wear two masks as opposed to one. This author has some really good points, and I'd like to go through them because I agree with some of them and disagree with others. So let's get started on this review article, this editorial. Op-ed, double masking is a double distraction. This author is a hematologist oncologist at the University of California, Dr. Vinay Prasad. And as we've been told, wearing a mask that fits tightly to your face can help limit the spread of the virus that causes COVID-19, the coronavirus. In lab tests with dummies, exposure to potential infectious aerosols decreased by about 95% when they both wore tightly fitted masks. A cloth mask over a medical procedure mask with knotted ear loops and tucked in sides. Now, a surgical mask are those blue masks. We've all seen them. You may even have them, and they're kind of thin. So what the CDC is now saying, we should be wearing that mask with one of our fancy cloth masks over it and making sure that it captures our chin and our entire face. Now, this was a study that was done by the CDC last week, and it was done on mannequins. So they're saying that more particulates were captured when the head emitted an aerosol from its plastic mouthpiece during a simulated cough than were captured by a surgical mask alone. So these were performed by mannequins, by dummies, right? This is not real life or real time study. This was done by mannequins and dummies, and it was a simulated cough. So all the headlines rang out. I'm sure you probably heard them. CDC says double masking offers more protection against the coronavirus. CDC updates coronavirus face mask guidance, endorses double masking. CDC report. Double masking can block more than 90% of viral particles. Now, this author had no doubt that the CDC's results were accurate, right? A cloth mask over a surgical mask is better than a surgical mask alone, right? When a mannequin sprays aerosol from its mouth in a simulated cough. This author would even wager that an additional mask will outperform just two masks in this test. Yes, three masks, and I would agree. So if you're performing a study on a mannequin, a dummy, and you put two masks, well, if you put a third one, there's going to be even less particulate matter that's going to come out in the simulated cough. And this author correctly states, this is not research, nor the headline that we need. And I would agree with that. So let's look at this study and why it doesn't answer some very practical questions, right? Whether or not a cloth mask over a surgical mask catches more particulates when a dummy head simulates a cough is a theoretical question, right? The practical question is, what actually happens when the CDC advises people to wear a cloth mask over a surgical mask? So let's run through this. The first step in answering this is to see what happens to a cloth mask over a surgical mask if worn by a human. So what happens? You try it. Put on a surgical mask, put on a cloth mask over it, and see what happens. In 15 minutes, this author tried it, and he had one mask shielding, as he said, one mask was shielding my chin, and the other was blocking my vision. Now, I don't doubt that. I've tried that. I've seen it slip down on my face. So is it really practical? Is it going to be tied so tightly or fit so perfectly that the purpose of having it is to block the particulates from coming out, right? But if it's all shifting around, practically is that practical is the question. So if this is so correct, if one mask were if two masks were to prevent particulate matter, viral particles from coming out, why did it take so long for this recommendation to happen? So nearly a year has passed since public health officials advised us to wear one mask. And I would argue with that actually, because early on in the pandemic, we were told that masks don't work. We were told that masks don't work not only by the Surgeon General, but by Dr. Fauci as well. It was not until the end of April, beginning of May, when it was starting to be seen throughout the world that masks probably do help, that it was starting to be discussed that in the United States we should be all wearing masks. Now, I'll just admit to you, as a doctor, I've been around viruses and infections all my career. I implemented mask wearing very early on. I was one of the few people in the supermarket early in March wearing a mask, and people were kind of looking at me strangely. And here I was inside knowing I'm a doctor, and other people looking at me strangely. I was probably a handful of people were wearing masks, and I was one of those handful. But it just made sense to me that it probably did work. And then lo and behold, couple months later, we're all being instructed to do that. Well, why did it take so long? If if one mask worked, then certainly two masks would probably work better. So that's what the author is asking. So at least some researchers have access to dummy heads capable of generating aerosols from their plastic mouthpiece. So surely one would have tested the double masking strategy sooner. And so this author asks, I wonder if two is good, why not three? Hey, why not, right? If someone is planning a future mannequin study, let's do it fast. Well, the question really is, does this recommendation slow the spread of the virus? Beyond the question of what happens when a real person double masks, there's a bigger question. What does advising people to double mask lead to? Does it slow viral spread? Well, we're a year into the pandemic and masks have become a polarized issue. Most Americans do wear masks, but some do not. So the vast majority do so in grocery stores, but only 15% do so when exercising outdoors. This result isn't surprising, as the World Health Organization, the WHO, okay, this is the organization that we're supposed to listen to worldwide, advises against mask use when exercising. Well, this is interesting because I exercise a lot and I exercise indoors. And where I exercise indoors, we have social distancing, we wear masks because, frankly, when you're exercising, you're breathing hard, heavy, and deep and fast, right? If somebody has COVID and you're indoors next to somebody exercising, your chances are pretty high that you're going to get it, right? Because you're spewing a lot of viral particles or a lot of respiration when you're exercising. Where I work out, it's very safe, and the mask is an athletic mask, works very well. I don't have any problem with it. It's curious, maybe outside exercising, I would agree, but indoors, I think if you're exercising, a mask, you definitely do need to wear a mask. But the question is, whose behavior will double masking change? People who don't mask already aren't waiting for a new study showing that double masks decrease particular dispersion to change their habits. Instead, the author suspects that double masking is far more likely to increase the number of masks among the fraction of people who mask most seriously. And I would agree with that, all right? I mean, people who are not masking right now are not going to say, oh, really? Oh, okay, yeah, so, okay, I guess one mask, I'm not going to wear one mask, but yeah, two masks, that sounds real good, yeah. So it's not going to change their behavior, and I agree with the author there. But the question, here's a deeper question that the author raises. Could the public message touting double masking somehow backfire? Might it lead to people on the other end of the spectrum, those who occasionally mask, to become irritated by flip-flopping messages and omit single masking more often? I would guess, yeah, I would guess that's probably right. Um, the bottom line here is an empirical question, and the right way to settle it with a would be with a massive cluster randomized trial. But there's a virtually zero chance of this happening, and I agree with the author here, making the value of this recommendation at the moment uncertain. It's really time, as the author states, to think beyond masks, and I would agree with that. Masks have become a visible symbol, and entire campaigns are targeted at getting people to wear them. The author has seen selfies, as you and I have, posted online of folks who ran marathon level distances with a cloth mask. Now, that's difficult, but it has been shown that wearing a mask does not decrease your oxygen level at all. So you can measure your oxygen. You can get a little device at the pharmacy and put it on your finger, measure your oxygen, and it doesn't decrease your oxygen in your blood. It is uncomfortable. Yeah, it can be uncomfortable, but it doesn't decrease oxygen levels. So that's, the case here is really not about that. It's about people's perceptions. And the mathematician Wes Pengden comments on COVID-19 with this tweet. Wes Pengden states that this is the pandemic in a nutshell. We have volumes of polling on whether Americans consistently wear masks, quote, anytime they leave the house, but no regular surveillance on questions like, quote, can you access paid sick leave? How many people fail to isolate when developing symptoms and why, right? So that question is important because, as the author states, we spend a lot of time thinking about masks and shaming people online about wearing masks. You've seen it. Come on, you've seen the pictures of people on social media, and you said, wow, they're standing pretty close. They're not wearing masks. Oh, what's that about, right? We've all wondered that. Well, we have forgotten many other measures. By doing that, we have forgotten many other measures that might offer greater benefit in preventing the spread of COVID-19, right? Think about this. If someone works as a cook and they feel ill, can they afford to call in sick? One analysis finds that cooks have the highest excess risk of death during the pandemic. That's something to think about. Instead of wearing a cloth mask when running 20 miles outside, we might be better off using that energy to make sure that the people who prepare our foods, right? The people who prepare our foods have access to N95 level masks and paid sick leave in case they fall ill. Now, N95 masks, those are the masks that are worn in hospitals. Those are the best masks, if you will. And if you have one of those, you don't need to double mask because they're going to collect or prevent much of the particulate matter from leaving your mouth into the general air. So getting cooks who are exposed and who may not be able to afford taking off, well, those we might want to make sure that they have access to N95 masks. So this author feels that double masks are a double distraction. The data on double masking are not drawn from real world usage, and the recommendation may affect only a handful of people who are at the lowest risk of having the virus. Spending time on this research question right now diverts attention from more pressing research questions that focus on the people, often the most vulnerable, who must continue to work in conditions that could be made safer. Now, truly, masks are a visible symbol. They allow us to feel good for doing our part to fight the coronavirus, and we can easily feel hate and antipathy, now be honest with yourself, right, toward people who do not wear theirs. Have you experienced those emotions? Come on, let's be honest, right? Double masking allows us to renew these emotions, but ultimately, these emotions are not helpful And for those of you who have listened to my videos, who have liked, commented, and subscribed, and I encourage you to do that, please, right below. I want to hear from you what you have to think about this, and subscribe to my channel. But those people who have already done that and have listened to what I have to say knows how much I put on emotions and how they could be very detrimental to our life, our negative emotions, like these feelings of hate and antipathy, right? When shaming or placed on other people. Now, shame and blame are not how we build consensus and curb pandemics. Nearly a year into the pandemic study, or into the pandemic, no dummy head study can save us. And I would agree with that. This author is talking about, let's think about real changes, real implementation of prevention, right? So that means who should be wearing masks and double masks? Well, I feel that it's very helpful from a medical point of view to wear a mask, that probably everybody should be wearing masks when they're in public settings and when social distancing is not possible. That's my feeling. Double masking, yeah, I mean, double masking will prevent more particulate matter from leaving, but let's think about who really gets coronavirus, who really is affected and can die from COVID-19. Let's be honest, okay? COVID-19 kills people who already have pre-existing medical conditions and people who are 65 and over. That's who COVID-19 kills. And why is that? Well, people with pre-existing medical conditions and those who are older have immune systems that have been stressed over the years. They have aged. They are less robust. They are less able to fight, and they are more prone to developing ailments that coronavirus causes, like the blood to coagulate more, or for them to over respond because they can't respond. Those immune systems and those people can't respond normally, so they over respond, the so-called cytokine storm, as many of you have heard about. So this is an overly excited immune system. But younger people and people who don't have pre-existing conditions don't die from this. And you're going to say, well, I heard about that 25-year-old who was very healthy and ran marathons and died. Well, COVID-19 is kind of the great equalizer. It will expose those people who got really sick. Well, you might have thought that they were healthy on the inside. You might have thought that they had a very strong immune system, but chances are their immune system was compromised somehow, and you don't know. And so what the reality is that the vast majority of people who do have those conditions, pre-existing conditions, or who are elderly, those are the people who are going to die from this. So maybe those are the people who should be double masking, because it will decrease the particulate matter that they put out if they have it, but it will prevent them from inhaling other people's particulate matter. So instead of having healthier people wear double masking and be really compulsive about it all over the place all the time, well, let's focus on those areas, such as the author talks about here. The path forward necessitates resources for places at high risk of pandemic spread, reliable childcare for essential workers, right? So they can work and they can take care of us. Paid sick leave for those people who are sick and need to stay home, and so they don't spread it. But if you don't have it, they maybe go to work because they can't afford not to work. Safe spaces to quarantine. Not everybody has those spaces. Rapid testing for results. Testing and results. I know I was able to get now a rapid test that I have in my house, and other doctors can get this, but why not allow? They're so simple. You don't have to be a doctor to administer these tests. They're very simple. Why not put them out there to places where people congregate? So to open things up, maybe at restaurants or Broadway shows or sporting events where you have an area where people could be tested right away and you get results within 5 to 10 minutes. I've done it. It takes no time at all. Why not? Why do you have to be a licensed doctor to administer these very simple tests, what anybody honestly can do? You don't have to be a doctor with a higher degree to do it. Vaccination with an urgency. especially to those people who are most at risk. Vaccinating everybody, yeah, I know we want to create a herd immunity by doing this, but in some ways, I have a little bit of a resentment for that because those people who are being forced to get a vaccine who are not really going to get sick from it. Yeah, okay. So the feeling is that, well, if you get those and they don't get really that sick, but they might pass it on to someone who could get very sick. Well, if those people who potentially could get very sick are vaccinated, why force it upon people who are not going to get very sick from it? And I know the question is, well, you don't really know. Well, if you're a healthy person and a younger person, it is up to you, I feel, whether or not you need to get the vaccination. And the vaccinations are safe, incredible science that came up with it. But do we have to vaccinate the masses? Well, that's another question for another time. This question is double mask or not double mask. That's the question here. And I agree with the author. Let's focus on vaccination with urgency and honest vaccine messaging. Harm reduction that moves human interactions to low risk settings. So the question is, who's at higher risk? Who should we be more concerned? These are questions we've been asking for months now, and unfortunately, people have politicized it, and it's prevented us from really looking at the facts. Well, let's look at the facts. COVID-19 is a deadly virus to some people. It is. It's deadly, and it's dangerous, and we have to protect those who are most prone to getting it and dying from it and getting very sick from it. We need to protect those people. Now, do I want to get it? No, I don't want to get it. I feel I'm a pretty healthy person, although I'm in an older age group, but I feel my immune system is probably very strong by the lifestyle and exercise that I do. However, do I want to get sick and get a flu-like illness? No, I don't. But does it come to the extent that I have to be compulsive to wear 2 masks or to get vaccinated? That's a question for another time about the vaccinations. But the double masking, I would say that this article, I would agree with, does not. I agree with the author that it's not imperative that we double mask. Maybe more dangerous populations. But let's go over let's go over facts, okay? That's what I want to look at, real facts, right? The mortality rate in 2016, that means all the people who died in the United States in 2016 was 2,744,248. In 2017, it was 2,813,503. In 2018, it was 2,831,836. 2019, it was 2,854,838. Now, I know, and I've seen on social media, people have been posting, we've hit the 500,000 mark on COVID-19, right? Well, that means that if that's the case and everything, all else stayed the same, that we should have 500,000 more deaths in 2020 than we did in 2019. Okay, so we don't have those statistics yet, but there was a conference and a study that was presented in a Johns Hopkins report in December, which unfortunately has been taken off a lot of places, if I will, censored. It has been, where a leading economist, a PhD, doctor of economist, did a study and revealed that the numbers in 2020 were that not much different than they were in 2019. Now that was removed, and it was removed by many of our news agencies, and that's wrong. Even if it's wrong, it shouldn't be removed. It should be rebutted, and it should be talked about in an open and honest conversation. But this was a leading scientist, economic scientist, and so we need to look at that, because if we're going to look at the deaths in 2020 and we're going to ask ourselves, are we going to believe it? Well, let's look at 2019, and the deaths from heart disease in 2019 were 649,000, cancer 599,000, well, close to 600,000, accidents 173,000, chronic lower respiratory deaths 157,000, death by stroke 150,000, death by Alzheimer's 121,000, deaths by diabetes 88,000, and death by influenza and pneumonia, 50,000. So I want to know in 2020 when the mortality rate comes out, how did COVID-19 affect total mortality in the United States? And certainly it did go up, but did it go up, and what happened to the deaths in those other areas in medicine, those other causes of death? So the reason why I'm bringing this up, it's important if you talk about now the CDC recommending 2 masks, everyone should wear 2 masks. Is that really is that really an intelligible recommendation? Or do we have to consider who's at most risk and what do we do with those populations? Age old question. And it goes back to the beginnings when we were looking at the most infirmed in the nursing home. So the bottom line here, when we ask 2 masks or not, my opinion, if you're at low risk for COVID-19 and you're going out in the public, I think 1 mask is suitable for you. Keep social distancing. If you're at a high risk and you're going to be in an enclosed area for a time, whether it's a supermarket, then maybe 2 masks may help a little bit better, but you have to make sure that you wear them correctly. So hopefully this information will enlighten you somewhat. Definitely let me know, comment, subscribe to my channel, as I'm going to be putting out a lot more of these videos. And as you know, I'm Dr. Charles, aka CoachMD, and I'm encouraging you to stay strong in mind, in body, and in soul. Bye for now.
Hey, Dr. Charles, CoachMD. Thanks for stopping by. Make sure to like and comment below. I'd love to hear from you. If you think you have a friend who might benefit from this video, share it with them. For access to exclusive content, support my Patreon. There you'll get private access to videos, meditations, health tips, even relationship and financial tips. You'll have a say in what I produce and be able to participate in a monthly call with me. Don't forget to follow me on Facebook, Instagram, and Twitter, and subscribe to my YouTube channel. See you soon.